Hello, I'm Nila Chakraborty. Welcome to SBW Talks, where strong women have real talks, share real stories, and keep it all the way real. This is the space where we drop the masks, unpack the layers, and speak from the heart. Today, I'm so excited to welcome Sudipta Lodh. Welcome to this podcast, Sudipta.
Thank you so
Since
much.
moving to Minnesota from India in 2013, Sudipta has built a beautiful life with her husband and two children. While she shines in her career as a software engineer, her heart is the fullest when she's with her two kids, making memories, exploring the outdoors, and practicing yoga. She's someone who embraces the balance of two cultures and two homes. I can't wait for you to get to know her. She's a sweetheart, and I've known her personally for a few years. Sudipta, welcome to SBW Talks.
Thank you so much for having me on your platform. I'm looking today.
Yeah, we're excited to have you. So, to start, I'd love to ask since you just had two kids, how old are your kids?
My elder one is 7 year old and my younger one is two, a little more than two.
You have some young kids you're running behind. What surprised you the most about your body after giving birth? Because I know you're very into health, wellness, and fitness. What was the first thing you're like, oh my God, this surprised me about giving birth?
That is a touchy question, I would say. I had my daughter in 2018 and I had a pretty easy pregnancy. I don't remember myself going out of the way, like eating or anything while I was pregnant. After pregnancy, took several months for me to lose to lose the weight. I kept looking pregnant for several months. The belly was so prominent. It was so prominent. Like I had several of my colleagues even ask me, like, when are you going to deliver the baby? At times it was like I really felt angry with that question. So, and like I would look into YouTube videos, compare myself with what I'm seeing there. That never matched my reality. Like I would still be looking pregnant, even though that baby is out. And not only looking pregnant, I was still feeling very heavy. So that surprised me a lot. I thought like doing exercises like crunches, heavy lifting exercises would help me. But that's not the case. I never knew that going easy can give you any benefit or any lasting results. So that was a totally surprising. I had an expectation and that didn't match with my reality. And accepting that was so hard for me.
Did you talk to your gynecologist or a friend or a doctor, someone about this?
At that point, no. But I did that with my second one. I did that. So uh, I took a step back. I reflected a lot on my first pregnancy. I had a list of the things that I wanted to do differently, and then I reached out to everyone possible, like especially with my gynecologist. With my second pregnancy, she gave me a referral to a pelvic floor therapist, and that helped me so much. The exercises that they offer are like pretty much doable, like new moms are so busy with their sleepless nights, running after the baby, feeding the baby, but even with that you can squeeze in like 10 minutes of exercises, and which are pretty simple. Even if you can do those from your bed.
Sudipta, was this after your pregnancy, the pelvic floor exercises?
Yeah, and like with my second pregnancy, I also went to a chiropractor because I had a pelvic floor pain. I was a little bit skeptical to go to a chiropractor, but it helped me. The pain that I'm talking about was not comfort. There was discomfort even when I would walk when I was pregnant. It helped me a lot. I would say we should go case by case. Both my pregnancies, my situation has been entirely different. Whatever worked out for me may not work out for anybody else, but it really helped me.
And did you have, I'm assuming, vaginal pregnancies, correct?
No, I had C-sections both.
Oh, you had two C sections and wow.
It doesn't matter what kind of birth you're having. You can still go for that because we are carrying the baby for 9 months. It does put a pressure on your pelvic floor, and who doesn't care about their looks, right? So it helped me a lot, and something that I'm so happy that I was offered. Like I came to know about it. With my first pregnancy, I used to follow some online tutorials, but it always feels good, like when you can talk to somebody, whether the movement that you're doing is correct or not. So
What were
that
some of the
really,
exercises?
one thing is like belly breathing. You can start that day one you have given birth. So the diaphragmatic breathing, which we do shallow breathing a lot. That mindful breathing helps a lot. And the bridge in yoga, if you do the bridge poses, so if you need to think of your breathing and do this pelvic floor contractions, thinking of a elevator. So I really cannot go back to the real terms that she used, but I can give you an analogy. Like if you are breathe in and you tighten your pelvic floor and then go to like floor 1, floor 2, floor 3. And so at that, when you are going up, so you are exhaling, and then when you are inhaling, then you are going down. A typical bridge pose in yoga. So that really helped me. Even leg raises. You can lie on your bed and do those exercises. In all the exercises, I found there was a heavy focus on breathing. It has become a second nature for me. Even let's say I'm getting up, I would tighten my pelvic floor. I have done that so many times. And I think, like you really started slow, and you can always go as much, you can make the exercises a little bit harder as you progress, but even the small exercises can have lasting results.
I don't think you even have to be pregnant. I mean, women can do this all throughout their life.
Right. I think anybody, like as we age, we really don't have to be pregnant to do these exercises.
It strengthens your core
Yeah.
muscles.
Yeah, absolutely. What you are saying, it strengthens our core muscles, and it can alleviate like several problems. Moms, they deal with back issues, and a strong core can help you in several ways. Can alleviate your back pain and several other like it. The benefits are much more than just looking like just fitting into a dress that you want to.
Right. It can also increase your stamina, your endurance, because for you, this is helping you.
Absolutely.
Oh,
Yeah, I found, as you were asking about the kind of exercises, I found a lot of similarity with the yoga poses. But when I was doing it, I did what I saw on videos, but like having that one on one guidance
mhm.
helped me understand where you need to breathe in, where you need to breathe out. That really, and that makes the difference. So like we have heard so much of breathing in mindfulness, but it can also help you in your with the exercises that we are doing. It can benefit much more than just being mindful and live the healthy life that we all want.
Sudipta, my question to you is, not a lot of people know about this pelvic therapy. How did you come to know about this? What made you be interested in this pelvic therapy?
So when I was pregnant, as I told you, like my belly was so prominent, and I didn't share much. So all I did was like browsing about my problems online. So I came about this term called diastasis recti. So and then I found one online tutorial called Mutu Systems. Don't ask me what it stands for. I forgot it, but it's a 12-week program that you can do. And there was again a lot of focus on breathing. It started very slow, and then it gained momentum. And another part to that program is that you must go for a walk. There should be a 20 minutes walk every day. So you can miss, like, let's say you can do 3 days out of 5 or 7 days of a week, the exercises that they are recommending, but you must go out for a walk.
Oh,
That was,
wow.
yeah. So I had all this knowledge. I was gathering a lot of knowledge, but when I was pregnant second time, I talked about my problem with my gynecologist, and then she suggested. And also when I went for the chiropractor, so when before I went to the chiropractor, I took clearance from my gynecologist that if it's okay to go or not, because I have never been to one before, before my pregnancy. And that kind of treatment was totally new to me. So I took clearance from my gynecologist. And I think most of the time the help starts coming in when we start to share. And if I don't share my problems with you, you do not know that I, on the other end, need some help, right? I think I'm glad that I did. I think we often, as women, we try not to share our problems. We also need to think of who can give us the right help. Rethinking that. So I think my gynecologist helped me. She understood what is my need, and she gave me the solution that I needed.
And
Yeah.
in the second pregnancy, to you, kind of taking ownership of your health, mentally, you were much more fitter. You were there for your child versus your first. Would you agree with that?
I think, this time I was there for me first
Perfect question. Yeah.
than even my child. Like I did it. We hear so much about self-care, and um, we it seems to be pretty simple, but we do not understand that. And when we are there to, like, when we are put on spot, can we really take care of ourselves? I think this time I was there for myself rather than anybody else, and I knew that everybody will be there for my baby, and I was there for my baby to feed him, to nurse him, also to clean the diapers, to play with him. But there I needed to be there, be present for myself first than anybody else.
No, that's great. Yeah. You always want to fill your cup first before you fill everyone else's.
Yeah, true.
What do you do for self care? Because I know you're busy working, you have so many other activities. What do you do for self care now for yourself?
So understanding what my needs are and what gives me the most happiness. If I am having a tough day, going out for a walk gives me so much of pleasure. Sometimes I try to go out without a headset and sounds of nature. If I'm having a trouble, like I'm having a troubling thought, I can tell you every time I have gone out for a walk, that has helped me keep myself centered, and then I feel I can keep the problem outside the home. The time I can step out for a walk. It's difficult when we are in the cold weather in Minnesota, but I try to go out for a walk even when it's like not sub-zeros. I try to go out for walks with my jacket on, with my hat on, earmuffs on, whatever possible things can keep me warm. But that is one thing. One thing I've understood is, help comes to you only when you ask for it. So sometimes and we often look for help on our partners. I think we try to make them fill in various hats, which is, I feel for my husband. I see him as a friend, I see him as a husband, I see him as somebody who can mentor me. And I think that is stuff for them to fill in. So at that point, we need to think of other people. We need to trust other people who can offer you the same kind of help. And there is also a taboo in the society, like not to talk about therapy. I feel people are opening up about it. So I feel like I can share. I have started with BetterHelp therapies first. So it was something that you could do online.
What is BetterHelp therapy? What is that?
Like you have this therapist online. It's a platform. It's an online platform where you can look for therapy. One thing which I liked was I was able to talk to them at my own timing. So I could
Yes.
still be at home. I don't have to go out. I can still talk to them. So I started there. I started that when I was pregnant. Like I feel I have put a lot on my husband, and sometimes it's not easy for him to like understand like what I'm going through. And
Especially as
maybe
a female.
he doesn't have the same hormonal issues. Maybe like we are so hormonal during our pregnancies. So starting there, I started with that first. And like finding a therapist who would match to your needs is very important. So I really liked what I had, but then it was also nice to see somebody like in person. So I still continue with that, and it's totally as per my need. I can keep it as soon as I want. As if I am very busy, then I can space out my schedule accordingly. So I think, we need to find that trusted network of people. And it doesn't have to be one people. With years, I think as much I have spent this many years in this country, and I have every thought that comes to my mind. The first person to share would be my husband. But I think he does a great job. But I think sometimes we need to share that responsibility with some other people. That one person doesn't need to take the toll.
And I think women also need a little bit of female friends that can
Right.
understand.
Right, right. I always look for a female therapist. Nobody can
Yes.
understand.
What we as females are going through. Yeah. We as women are going through different phases. As you're in a phase of raising your child, you just gave birth. And then a few years later, you'll be going through a different phase in 10, 15. It's all different. And I think you correctly said you have to find the right therapist, which so many people don't do.
Absolutely. And I would say that too, at one point, let's say, even sharing your frustration the same way you would with your near or dear one, you can share that same frustration with anybody else whom you are, even with my therapist. If there is something that is not working out with you, be vocal about it. And they are there to help. Or maybe they can offer you different kind of guidance. Maybe they are not the right people for you. They can share other therapists, contacts of other therapists who can be of you, of your, like, that can match better as per your needs. So don't shy away, be vocal about your needs.
Did you go through postpartum depression a little bit with any of them or no?
With the first one, yes, I would say, when I when you give birth, you feel you need to have that connection with your child immediately. And, like, I waited so long to become pregnant. And when I became pregnant, I like that kid, like that's my own baby. She's so cute. But, it takes time when, let's say, breastfeeding is not going as per expectation. Things like I really wanted to have a natural, like a vaginal birth. It didn't go as per plan. Too many things. I was so overwhelmed. So yeah, it contributes a lot.
It does. I think
Yeah,
women go through
yeah,
so much
yeah.
mentally and physically.
I felt like that postpartum depression, and I joined back work pretty early because I was not able to take it at home. So I didn't even make use of my short-term disability entirely at that point. So I got around 12 weeks, and I went back to work at 10 weeks. But this time I was so prepared, and that helped me so much. I enjoyed my leaves, like my maternity leave, to the fullest. And I was so lucky that, like, I think I got the things I wanted at the right time. Like, I had an extra, I had the short term disability. On top of it, my company gives 14 weeks of maternity leave. So I used them to the fullest. I have seen, like, people, like many new moms in my company, they do not make the full use of it. I understand where they come from. Like, it's a very challenging job situation right now with, and everybody is replaceable. So I have seen people not using the leaves that they get. Like, we need to bond with our kids, and I totally understand. I'm nobody to judge them or anybody, but I was able to take that decision for myself, not only just to spend time with my baby, but to heal myself, to take care of myself more than anybody else. I'm so proud of it.
Yeah, you should be proud. This is such a great conversation. Tell me about breastfeeding because I know that's a different topic in itself.
Oh, yeah. So tell me, I do you think, like, there is it's kind of a promotion that breastfeeding is best for the kids? Like, I feel like that. And, like, nobody prepares you for, like, what's definitely it's great. Like, it's you I was able to breastfeed my first kid only for a month. And, at that point, things didn't go as per plan. It's a combination of both guilt and shame. And I felt like I was not able to provide for my kid. I really felt like that. And I think I took that guilt for years. So, and even when I tried a lot harder this time for my second baby, I took several appointments with nurse practitioners for this nursing sessions. So it goes as per my expectation. But nobody talks about, like, nobody prepares a new mom for, like, okay, you should be prepared for the sleepless nights, okay? And nobody tells you that it's okay to bottle feed your baby, because I see a fed now. It's not that I have been doing that, but now I have the realization that a fed baby is a fed baby. I see no difference in how both my kids are growing up. I see them growing up equally healthy. Touch wood, that stays. So I feel like we should promote it more as a choice. It could be either or, neither nor, both are correct. It's your need. And I think I cannot be so harsh that saying that the society doesn't prepare you, because when we are in the delivery room, I remember the nurse asking us, do you want to breastfeed or not? Most often we say yes. I think that comes with the societal norms, maybe. Like I've seen, and something that really we need to do it for ourselves is like, I took a lot of shame on myself when with my first baby, that breastfeeding did not go as per my expectation, when I'm hearing about every like many of my the new moms that I know are able to breastfeed. So we are often in that comparison loop, and it's very hard not to compare. I feel sometimes comparison helps, where you can learn a lot from others, but if it is going to take a toll on you, you should stop and rethink, and always again ask for help. Ask for help. I could not. I have been somebody. Have tried to keep things to myself, but as of time, like I've learned from my mistakes, and I have opened up a lot about where I need that help and whom to ask for help.
Very true. I
Yeah.
think as a first time mom, we're learning. And this time, I think you were more educated and you took the steps
I
necessary.
right. I like what you are saying. Like that's the right term to use.
And I think you did the smart thing because a lot of moms don't take the necessary steps and they just go on repeat,
Mm-hmm.
making the
Yeah.
same errors. And here you took that choice of, okay, let me find that solution so I can be a better mom, a wife, a daughter, a sister to my family. Let me
Mm-hmm.
fill my cup first and then I can fill others.
Yep. Yeah. Yeah. So true.
What
Yeah.
other do you want to let I mean this was such a nice podcast. It's different from the previous ones. What do you want to let our viewers know, Sudipta? Because you told us about being a mom and you're almost a new mom.
I couldn't stress enough, like, ask for help. I think if, and also hear from everybody, like, take as much advice as possible, but do what your heart tells you to do. So, take in as much advice, don't ignore. And don't hear, listen to what everybody is telling you, understand, but it may or may not be the best solution for you. Your case may be entirely different from everybody else, and sometimes you even have to ignore, not ignore as in not do the things. You are being mindful, you are listening to everybody, but you may need to make a choice which could be different than your closest people are suggesting you, and that is totally fine. You need to you need to feel empowered, and because nobody else is going to do that for you. So, and I cannot stress enough, like, ask for help, and you need to find your trusted source, like a trusted network of people where you can ask for that help. And like, I would always, like, if it's a medical need, I will always go by what the doctor is telling me, not anybody else, whether even if that's my closest relative.
Yeah, true.
So, yeah. So, two things: ask for help and do what your heart wants to do.
Very good advice. Now, my question to you is I know a lot of moms are looking for the resources. Where did you go look for your resources?
So, you could search for Mutu systems online.
How do you
Like,
spell that? How do you spell that, Sudipta?
it's MUTU and then system. You can
Okay.
search for that. Another great YouTube channel is Pregnancy and Postpartum TV. It is, have to talk about her. She does very short exercises. Jessica, yeah, her name is Jessica, right? I do not know her full name though. So she does very short exercises, 20 minutes, 10 minutes exercises that can easily fit into your routine, even on your work days. And I am, it's like I'm 2 years postpartum. So I'm still doing her exercises. You will often, like, in many of her exercises, you will feel very sweaty. And I would say definitely talk to your gynecologist about, because I was referred through my network for a pelvic floor therapist. So it could differ for everybody who are looking out for those resources. But then you can definitely start with Pregnancy and Postpartum TV. There are many exercises that you could do during your pregnancy as well. Very something that can easily fit into your routine, and some, and for every level. Like it could be a beginner, intermediate, or if you're looking for heavy lifting exercises.
I think this pelvic therapy, even like postpartum, I think like me and my group of friends, we're in that perimenopausal phase. Some have already gone through menopause. And I think this is like a great pelvic therapy that I don't think none of us knew about. And I think it can really benefit women through all phases of their life.
Yeah, 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 absolutely. I s- I have thought about this like while doing the exercises, exactly what you are telling. It's something that I can carry this knowledge throughout my lifetime. And these exercises are something we can incorporate in our daily life so easily. These are basic exercises that all of us need to master.
Are the Kegel exercises part of this? The Kegel?
Absolutely, absolutely. Yeah, you know more than what I know. Yeah. When you were asking me about it, yeah, absolutely. Yeah. Kegel exercises. Yes.
Yeah, because I think when we get older,
Yeah.
those really help.
Yeah. Yeah.
Because the
Right.
elasticity goes down, Sudipta. No, this is a great What else do you want to let our viewers know? Because you're like a genie with all this information.
Oh, thank you. See, I explained the Kegel exercise with that elevator analogy, but you use the right term. I think, like pay yourself as much importance as you are paying others. Yeah.
So true.
So true, right? And you have stressed enough, like filling your own cup. If we don't do that, like we cannot be present for anybody. If we are not present for ourselves, we cannot be present for anybody. So yeah, yeah, that's it.
Yeah. No, thank you for your time. I think you went through a lot of topics. I mean, and you're, as you said, you're 2 years postpartum, but I think a lot of women can carry what you're saying through all phases of their life. This is a very important podcast for all women who are watching this, even for men, so you can understand what women go through the various stages of, I think, the hardest we've done.
I keep telling my husband, you have to educate yourself about how a woman's body changes because the toll is going to come on you. Like as you're talking about this menopausal and the menopausal phase, I feel like I would have educate my husband about it because he is the first person I'm going to look for support. And he and my and also like one thing I've started doing differently is talking about my needs with my kids too. My younger one doesn't understand anything, but especially with my daughter, like if I'm behaving in a different way, I know I'm not able to take it on. I would explain it to her first instead of like,
Hiding it.
yeah. So you know that I am not able to take multiple things at a time. I will explain her what is my situation. So it's not confusing for her, like why my mom is behaving in this way.
Right, right,
Yeah, yeah. So, yeah, I think it's very important, as you are saying, for even men to be educated about because I sometimes feel bad for them because if they do not know, they do not know the problem, they do not know how to help.
right.
Yeah,
And I think one good thing is you have, for our viewers, she has a daughter and a son. Your daughter is like 7, right?
yeah, yeah.
So she'll be also starting her teenage years very soon. And I
Very
think you're
soon.
doing the right thing by educating her now because she'll know, okay, I'll be going through this. I'll know what to do.
Mm-hmm.
And especially as South Asian parents, we're always hiding, especially
Mm-hmm.
women. We don't talk to our daughters about anything.
Right, right. Yeah, yeah. It's yeah, more the sooner we do that, we are helping them. We are not only helping us, we are also helping them.
Correct.
Yeah,
And I think you're doing the right thing, Sudipta, by explaining things to your daughter because she's going to go through this phase very soon
right.
in a few years and they won't be scared. They'll
They
be like,
won't be
okay,
scared.
this is normal.
Yeah. And like that acceptance will come sooner.
Yes.
Yeah.
Yeah. No, thank you. I think we need to do a podcast on that. How to be strong women, especially South Asian women, because we don't talk about a lot of these taboo, like mental health, body, or how we're changing.
For somebody like me who might enter this perimenopausal phase soon. So, like, we need to again educate ourselves as well, right? Like, if you do a podcast related to that, it's more about, you can find this, we can find podcasts like now with internet, like it's a wide forum. We can find a lot of podcasts, but it's somebody good to know, like in your society, in your community, and learn from their experiences.
That's
So,
another thing. I've been looking for one, but it's so hard finding women to come out.
right.
Even doctors to come out and talk about this.
Oh, okay.
That's like another topic in itself. No one wants to talk about perimenopause. No one wants to talk about menopause. So if you're a viewer listening and you want to talk about it, we would love to have you as a guest on this podcast because it's so needed. It's so needed.
Yeah, so much. Yeah.
So much. Thank you, Sudipta. I mean, you were enlightening, you were educational, you were great to have as a guest. Thank you for coming on SBW Talks.
Thank you so much. It was such a fun, and I learned a lot from you. Thank you so much for
Thank
having
you.
me. Yeah.
Thank you. And we'll do another podcast on raising daughters.
Oh, that's
We
nice.
should do
Yeah.
one. Yeah.
Yeah.
Thanks all our viewers. And then we'll have Sudipta's podcast up soon. So we'll let you know. Thank you.
Thank you.